Good morning and welcome back. This is Daybreak and thank you for staying with us. The hashtag on X is Daybreak. The SMS code is 22422 at Citizen TV Kenya and at Ayub Abdikadir. With me in studio, Stanley Kamau is the Chief Executive Officer, Harry Trust. Good morning, Stanley.
Good morning.
Thank you. Happy to have you.
Nice to have you here.
For this timely discussion. Dr. Yvonne Orlando is the Director, Preventions and Treatment Programs at NACADA. Thank you, Dr.
Thank you
for your time as well. Also with us in the studio is the lawmaker representing Moya constituency in the county of Kirinyaga, Honorable Mary Maingi. Good morning.
Good morning.
Thank you. Happy to have you on the broadcast, and as well the Kitutu Church South lawmaker Anthony Kibageni. Good morning.
Good morning.
Thanks for your time. We'll be talking about alcohol and the drug menace in the country. What happened in the county of Kirinyaga recently, ladies and gentlemen, is just but a representation, a microcosm of a larger nationwide problem that ought to be fixed. And I begin with you first, Dr. Yvonne Orlando. What is the immediate fix to this problem? Of course, we'll be looking at some of the details in your reporting and what you have detailed there in terms of consumption when it comes to illicit brew and other drug substance abuse. But what can be the easy immediate fix to the problems that we continue experiencing across the country?
Thank you for the question. The Kirinyaga incident was very unfortunate. And we saw the leaders come out and the whole county was actually in pain, and even Kenya at large. We have had issues of illicit brews across the country, but we like the way it came out this time that if you're brewing any illicit brew, then be prepared that there'll be consequences. And I think that is the first step. If you can stop all the illicit brews, the ngao to actually crack down on these dens so that is no longer an issue. Also, in terms of licensing, when it comes to the licensing of the alcoholic outlets, we ensure that the ones which actually meet the standards are the ones which are licensed. This will then protect the Kenyans. And of course, the education on the impact of consuming illicit products should also be highly expressed out there.
Stanley Kamau, then I come to you on this. Given that what happened or what continues to happen and in the cover of darkness, under the cover of darkness, is largely the greed from traders coupled with laxity on the part of officials who ought to be managing this problem. I mean, how are these two situations contributing to an already dire situation of alcohol and substance abuse across the country?
One thing I can say is that the Kirinyaga issue is not new. It's only that this time people died in big numbers. People die every day.
Which is unfortunate.
Yeah, they die every day. So the issue of people dying is actually happening even today. Even today, if you go to Kirinyaga, there's 2 people who are drinking. And my biggest issue is, she's talked about licensing and closing the dens. I can tell you, people are dying because of smoking bangi. Are we closing bars that sell bangi? There is no institution, there is no shop that sells bangi. These dens are not even licensed. There's no a matter of licensing, because we are affecting legit business people by closing their bars. But the people who are selling this illicit brew, they're not even licensed. They actually, if you go to Mashinani, you'll find out that people who are selling illicit brew, they actually even vendors at the homesteads, not even in the bars. They're actually selling at the community level. They have vendors, they have agents in every particular village. So I think the best we can do is to inform the communities, because every village, every homestead, for example, every parent knows where his son or his daughter drinks. Every wife, every husband knows where their spouses drink. Every chief knows who sells illicit brew. So we can only bring in the communities to be able to fight these fights if we need to succeed.
Yeah.
The matter of fighting these fights in boardrooms or in meetings, it can never work in this country. We need to go to the grassroots, identify those people who are selling the illicit brew and other drug substance of abuse, and then we can weed them out. We can never weed them out by actually closing any particular bar, because these are not where these illicit brews are sold.
Okay.
And I can tell you for sure, the people who consume this illicit brew, they have no capacity to sit in a bar even for 10 minutes. These are people who just take a shot. Within 2-3 minutes, they are gone.
They're on the move.
They're on the move. They don't actually sit in a bar. So those premises where are licensed,
okay.
I think they should revise the ban on Kirinyaga outlets.
I'm looking at the number of the segmented numbers provided by NACADA, because we have 3.1 million alcohol users in the country, tobacco 2.3 million, cat or miraa 964,737. Cannabis, which you mentioned, comes at a distant fourth, 518,807. And it's on that note I come to you, because largely what the directives given by the government in regards to the operations of bars, Honorable Mary Maingi, coming to you, because this is where it's your constituency where the death happened. Given what we have seen, was it a knee-jerk reaction on the part of the blanket or the wholesale closure or shutting down of bars, some who are legally registered? Is that not unfair on their part? And how can a knee-jerk reaction address a problem that is deeper and needs more consultative approach to address it?
Thank you so much. And allow me to first start by sending my condolences to the families that lost their loved ones due to illicit brew in Kirinyaga, in Moya constituency, and particularly in Kangai ward. Abdul Kadir, shutting down the bars in Kirinyaga, I don't think is a big price to pay compared to the lives that we lost. Mm-hmm. You remember times of COVID, all of us were subjected to checks, in fact, spot checks, and to wearing of masks. And this time around, the governor and the directive from the deputy president was we shut all the bars and vet them afresh. Mm-hmm. It is in this vetting that we are able to say that you cannot be licensed if you are a civil servant to sell alcohol. It is in this vetting, the fresh vetting, that we are able to say that your bar operates within these meters, within this or very close to public institutions like schools, hospitals, and churches. Yeah. That one is not getting licensed, and we are able now to say you are not going to get licensed if you are not going to operate within the designated areas. We are able to check a lot more now afresh. We are able now to recapture the control that looks like had gone, slipped away. Yeah.
Okay, but more or less, Anthony Kibagandi, coming to you. It seems there is a failure on the part of the watchdogs who ought to be monitoring the situation from the licensing, and also NACADA, which ought to be playing more, responsibility other than enforcement in terms of creating awareness. And there seems to be gaps in all these processes. And is that the reason as to why we have such occurrences?
Thank you. Thank you for inviting us to discuss this very, very important topic. My brother, you ought to be informed that I am the chairman of a parliamentary caucus that is focused on creating awareness on effects of drug and substance abuse, parliamentarians against drugs and substance abuse. And today, we shouldn't just focus on Kirinyaga, like Senior Kamawa said. We need to focus on the wholesome trouble, the menace of drug and substance abuse across the country, that the government is going very slow on curbing. And like you have said, indeed, the biggest problem lies in two areas. One is in enforcement, integrity of the people who enforce the law, and that is police officers. We start with the assistant chiefs, come to the chiefs, the provincial administration, and the police officers. Most of the time, they are the ones who enhance the trade of illicit brews. And going beyond illicit brews, there is enormous abuse of actually legal beer, legal whiskey. These are things we need to be talking about. And like you have said, integrity of enforcers is the greatest challenge. Secondly, we need to create awareness. We shouldn't blame NACADA, because I have worked very closely with NACADA from the time I was an advisor for youth affairs in the presidency, and even today. NACADA they usually make a lot of effort, but they are incapacitated in terms of funding. Government doesn't seem to realize that this is a major problem that is messing up with a certain generation. So government only gives them, crumbs in terms of budgetary allocation. And that is why they do not have capacity in terms of personnel. Even now, NACADA has regional offices. They don't have county offices, And even in terms of enforcement, they have to work closely with police officers, The officers they have within the institution are few. So we need to increase their capacity for them to be able to create awareness across the country. The other thing we need to be looking at, what are the effects of substance and drug abuse? And when I talk about substance and drug abuse, we need to look at what, like I said, those that are sold regularly in pubs and those that are banned by government or even WHO. And the effects are enormous in this country. One, we have put together a community of young people that are doing nothing. There are areas that they become zombies. If you look at the Kirinyaga case, the people that were talking, it means the people that were confessing that they've been taking that particular brew are people who look like if they had an opportunity, they would be very important human resource to work in the farms, to work in industries. But now they waste their time partaking in that particular brew. They have disintegrated families, which brings about inappropriate parenthood, which enhances poverty. And these are some of the things we need to be looking at in a broad spectrum and push government to increase funding to NACADA. And again, I'm coming up with a bill to try and disconnect the NACADA from the Ministry of Interior. NACADA needs to work with the Ministry of Health. The anti-narcotics is what needs to be in the Ministry of Interior, because when NACADA is in the Ministry of Interior, the what I can call the demeanor of the Ministry of Interior in terms of matters to do with because when people start drinking, it's a disease. They need to be treated. Rehabilitation is treatment. And all this. It is not enforcement. It is not law enforcement. So going forward, we need to think about moving NACADA to be a department within or an agency within the Ministry of Health. And enhance the funding to NACADA.
The question of then seeking the answers, and seated here are two parliamentarians, you and Honorable Maingi here, because I'm looking at the numbers. This is by NACADA September 2023. Illicit liquor consumption in terms of region, Western Kenya leads by, that's Changa, 11.4%, followed by Nyanza at 6.3% and Eastern at 8.4%. Now, if we are to get our eyes on the other crisis which seems to be brewing in Western, in Nyanza, Eastern, and the coast, I'll be coming to the other numbers that NACADA had given, seems that the funding you talked about is much required here. How then would you push for that, for proper personnel, and getting down to these people who seem to be affected and is crisis that is unfolding before our eyes?
As the Caucus for Parliamentarians Against Drugs, we have sent our proposals to the budgetary committee, and we have been working closely with NACADA to ask them to stop being shy, because again, they are a shy institution. They don't seek for adequate funding because they are used to being kugandamizwa by the Interior Ministry. They are given the least amount of resources to do their job, so they only seek modest funding to their institution. So we are asking them to step up, and then I have sat with the chairman budget committee and told them about this, and he told me even in Murang'a they have a big problem. That is Honorable Ndindi Nyoro. And he told me the greatest challenge is, the budget does not come from NACADA, what we debate or discuss in Parliament.
Yeah.
By the time it gets to the point I also get involved, it comes as a package from the Ministry of Interior.
Okay.
Yeah? And that is why we are saying from within their house, they need to stop being modest and demand that we need personnel, we need this amount of resources. We need resources to create awareness. We need resources to actually pay for time on TV, pay for time on radio, even vernacular radio stations, so that they talk about effects of drug and substance abuse so that masses get to understand what they are going through. We have been finding fault all this time in NACADA, in the police, in the Ministry of Interior, in the presidency. I think we now need to start finding remedy. How do we deal with this problem? How do we deal with this problem?
And that's why we're having this discussion, because we're looking for answers. And allow me now to...
sorry, just...
yes, finish up.
What happened in Kirinyaga and the closure of bars is a knee-jerk reaction. The deputy president and his spouse have been doing, one of the very few things they've been doing right is the advocacy.
For the boy child.
Yeah, other than the boy child, advocacy on, or making noise about destruction of these illegal dens and stopping the illegal brewing of these illegal brews. They have been making adequate noise. And it is time now to actually go into action and demonstrate that we are dealing with this. You realize...
Okay, allow me to pause you there. We will proceed and I'll give you enough time to respond because I need to move on to Dr. Yvonne here. Dr. Are financial constraints a major factor that is hampering your delivery of deliverables, in this case, reaching out to the numbers that I've mentioned from your report, which appears to be burgeoning and keeping on growing day by day, and if not addressed, would be a crisis before our very own eyes?
Thank you for that. And yes, but before that, allow me to just respond to Honorable Kibagendi. For the advocacy, we are grateful. But NACADA is well placed within Interior. Because when you look at the issue of alcohol and drug abuse, it is not just a disease aspect. Addiction and drug abuse also has the crime aspect. It has the supply aspect. And that is why NACADA is well placed under Interior. And yes, as Honorable mentioned, the issue of low funding is a serious challenge because NACADA has 9 regional offices to cover the whole country. And you realize this then is not enough. As coming like next month, NACADA will be rolling out another 10 offices because the lobbying that Honorable Kibagendi and the rest of the team have actually been according NACADA in terms of support for funding. And because of this, we'll be rolling out more offices to try and reach to the grassroots. The challenge is clear. We do not have enough funding, therefore we do not have enough personnel. But what we have done, we are using the community. We are rolling out programs. Like we have a program called the Community Work Groups, where we have actually reached out to the civil society organizations, the faith-based organizations, NGOs, and any stakeholders who are doing this work at the grassroots. So what we've done is we have brought them together, we are capacity building them, so that even as you're intervening, be it in prevention or in treatment, then do the right thing. Because we've had cases whereby in the name of intervention, people are being bound up so that now don't drink. Or you bring together people and you lock them in a room and say that now this is treatment. That is not treatment. That is inhumane handling. Therefore, we are bringing them together and training them. If you go to schools, what do you do in schools? How do you intervene in schools? When you go to the workplaces, what do you do? When you come to families, because this is the basic unit, how do you handle families? Because we accepted that as NACADA, we'll not be able to get there. But when we use people who are already there and we empower them, then we know this message will reach there.
And how,
so yes,
how
funding
effective
is a
that?
problem.
How effective is the engagement, for example, of the family unit and other stakeholders?
It is starting to pick up. Initially, most family members are not seeing their role when it comes to alcohol and drug abuse. Until now, we rolled out a program called Positive Parenting, where we are highlighting, if you're a father and you're drinking here, what do you think the child is seeing? If you're a teacher and you come to school drunk, what are your students saying? And as a teacher, you're a parent. So we've rolled out this. We've worked with the faith-based institutions, both the sheikhs and the pastors. We've reached out to them, trained them in the different associations, and they are talking to their people because we know they have the masses. And slowly but slowly, we're actually getting many people calling and saying, come to our church, send people to this mosque. So the impact is starting to be felt.
Thank you. When we get back from the break, Stanley Kamau and Honorable Mary Maingi, we proceed with the discussion here as we look for the answers and how best can this problem be addressed. The hashtag on X is Daybreak. The SMS code is 22422 at Citizen TV Kenya and at Ayub Abdikadir. We continue after the break here on the broadcast. Stay tuned.